Hello, everyone, and welcome to Science Together, a podcast series by DBT Wellcome Trust India Alliance, where we delve into the science driven by the researchers and their remarkable journeys in science. What better way to commemorate National Research Administrator Day, September 25th, than by launching India Alliance's podcast series that aims to highlight our fellows' research and the impact they are creating in society. I'm your host, Satish Chris Raghu. We live in a universe where our understanding of our existence and the many facets of it are governed by science. Yet global science literacy is a far cry from reality, and we have a long way to go in nurturing our innate scientific curiosity. Our pilot episode features two amazing scientists. They are pursuing their India Alliance Early Career Fellowships. We are joined by Dr. Deepak Kamath and Dr. Pattabiraman Chitra. I'm so excited right now. You have worked remarkably hard to get to this point in your respective careers, and everyone listening wants to know a little bit about yourself and your respective research projects.
Hi, I'm Dr. Deepak Kamath, Assistant Professor of Pharmacology at St. John's Medical College, Bengaluru, India Alliance Early Career Fellow. So my research work focuses on patients with a diagnosis of chronic heart failure. Patients with chronic heart failure have a high risk of mortality and they tend to get rehospitalized often. So my research work deals with improving the concept of self-care, which is how well patients and families take care of themselves. We're trying to essentially change behavior in order to improve patient self-care by using a combination of cutting-edge behavior change theories and techniques and translating them into practice, as well as technology, that is mobile health technology, and trained lay health workers in order to try and change patients' behavior for the better. At the end of it, we would like to see rehospitalizations reduced among patients who are getting these interventions, as well as a reduction in death rate.
Hi, I'm Chitra. I work at the Department of Neurovirology at NIMHANS, Bangalore. I work on brain infections. So that's when a person, usually a child, comes into a hospital with a history of fever and some neurological complications. I use molecular tools to ask if there is a microorganism that is the culprit. As part of this work, I've had the opportunity to work at district level hospitals and medical colleges, together with government officials, clinicians treating the disease, and the people affected by it during outbreaks of brain infections in Uttar Pradesh and Assam. As you can imagine, knowing the organism is critical for treatment and prevention.
Many youths in India today may think that a PhD or advanced studies in science are out of their reach. Dr. Kamath, what motivated you to push this far?
Well, it's the thrill of generating new knowledge, of finding the true answers to questions that you're really interested in. Lastly, clinical research gives me the opportunity to touch the lives of several thousands of patients once I've completed either one substantial research study.
What about you, Dr. Chitra? What motivated you to push this far?
So if science and research are what you want to do, and that's your calling in a way, then you have to find and keep searching for good environments. Don't give up on that. You're good enough. If you want to do this, then just keep at your learning. Keep an open mind. Stay open to opportunities.
Recent statistics reveal that there is a significant gap favoring male PhD enrollments as opposed to females. Dr. Chitra, what would you advise young girls or college pursuants, etc., about choosing a career in science and research?
I used to think that if you're good enough, if you work hard enough, it doesn't matter what gender or caste or background you come from. This is not true. The system as it is now does keep some people out, so the resistance that you feel is real.
What were the main challenges that you've encountered in your younger years while pursuing science? Let's start with you, Dr. Chitra.
You must find people and environments that support you to do your best. This is important. The other thing is that nothing about our education system prepares us for learning from failure. When we set up experiments, we very often fail. And a lot of learning happens from failing. It took me some time to understand that this is not me, this was just the process. And this is the challenge, and it requires a certain kind of discipline and some sort of critical thinking, like learning about that.
Dr. Kamath?
Well, in the beginning, it was a lack of experienced mentors, but then I was fortunate enough to train in a place in my postgraduate days where I found experienced mentors. So then it was resource constraints, funding constraints, and so on, until the India Alliance came along.
What adjustments did you have to make in order to persevere in your respective research projects during the pandemic situation and the lockdown?
Well, there weren't any adjustments per se, but an intense interest in my research question kept me and my team driven. Secondly, patients with chronic heart failure, since they are connected via mobile health technology to our hospital, felt the intervention to be of great help during the pandemic.
We slowed down work a lot on the brain infections project between March 2020 to June 2021. All our efforts and all our learning that we gathered about working in outbreaks as an entire team was leveraged to do whatever we could during the pandemic. So we sequenced SARS-CoV-2, studied the introduction and evolution of the virus in the local setting, engaged with the researchers, diagnostic laboratories, state officials with our data, so that it could feed back into the system.
Before we conclude, please share with us an element of your research project that you find most rewarding.
Patients who are participating in our study have experienced satisfaction that they have remained connected to the healthcare system through the first and second waves of the pandemic. We are also confident that changing patients' behavior towards better self-care will translate into reduced risk of rehospitalizations as well as mortality, and thus benefit both patients and their family members immensely. Thank you.
The bit that I find most rewarding is the people I work with and engage with, and the ability to work on a real world problem and offer solutions that might help people.
Thank you so much for taking the time to share your insights with us. I'm sure that our discussion here today will inspire many to explore careers in science and research. And thank you for listening, everyone. This is just a taste of what is to come. More about the research that we've covered in today's episode is shared in the description below. And so concludes the pilot episode of Science Together by DBT Wellcome Trust India Alliance.